You know that little twinge you get in your knee sometimes? It feels like just a simple ache, right? But what if it's actually a message? A clue from your body about something much, much bigger going on inside? Well, today we're going to decode those signals. This isn't just about your knee, it's about your whole health. Okay, so let's just imagine for a second. What if your knees could actually talk? What kind of stories would they tell you about your overall health? We're about to go on a little diagnostic journey, and we're going to start with some simple at-home tests that might just blow your mind. And look, this isn't just some wild idea. Rheumatologists, the real experts, see this stuff every single day. Joint pain is often the very first clue that leads them down a path to a diagnosis that you'd never expect. So the big idea here is, we've got to look beyond just the knee. All right, first up, let's do a little interactive test. Go on, stand in front of a mirror and turn to the side. Now, lock your knees. Do they kind of bend backward, past a totally straight line? If they go back more than about 10 degrees, you've got what's called genu recurvatum, or hyperextended knees. And that's our very first clue. But hey, we can't just stop at the knees, right? We're going to build on this with a few more moves from something called the Baton score. Come on, try these with me right now. Can you bend your pinky finger back past 90 degrees? Now what about this one? Can you touch your thumb to your forearm? How about your elbows? Do they hyperextend? And for the grand finale, can you put your palms flat on the floor without bending your knees? So, how'd you do? You get 1 point for each of those little maneuvers you could pull off. If you scored a 5 or higher, that suggests you have something called generalized joint hypermobility. What that really means for you is that strengthening the muscles around your joints is absolutely crucial to keep pain and injuries away. And this is a perfect example of what we're talking about. For some people, that hypermobility is a big red flag for a genetic condition, something like Ehlers-Danlos syndrome. If that were the case, you'd probably see other signs too, like skin that's unusually stretchy or fragile. You see, it's all connected. Okay, you ready for the next test? Stand in front of that mirror again, this time feet together, ankles touching, and keep your knees straight. Now look down. Do you see a gap between your knees? If you can fit more than, say, 3 fingers in there, we call that being bow-legged. And in an adult, that can be a really significant clue. Now, check this out, because this slide shows you exactly why that happens. On the left, see that nice, healthy black space on the X-ray? That's your cartilage. It's your cushion. But in the osteoarthritic knee on the right, that cartilage has worn away, especially on the inside. That makes the bones grind closer together and literally changes the angle of your knee. But I gotta tell you, that whole wear and tear idea, it's way too simple. Especially when osteoarthritis shows up early in life, it's a massive wake-up call. It is strongly linked to metabolic problems like diabetes and high cholesterol, and even higher rates of heart and kidney disease. But what if the problem isn't your cartilage at all? To get our next condition, you gotta understand this process called bone remodeling. Your skeleton is alive. You have these tiny little cells that are constantly breaking it down and rebuilding it. You basically get a whole new skeleton every 10 years. Well, in something called Paget's disease, that whole remodeling process just goes haywire. It goes into overdrive. Bone is broken down way too fast, and the rebuilding is just frantic and chaotic, kind of like throwing bricks at a wall and hoping it holds up. The result is weaker, bigger, and warped bone, which can create that bow-legged look. The problem isn't the joint space, it's the bone itself that's changing shape. Okay, let's shift gears a little bit. What if your biggest complaint isn't about how your knee looks, but how it feels first thing in the morning? We are now wading into the world of inflammatory arthritis, where your very own immune system is the bad guy. The big telltale sign is something doctors call the gelling phenomenon. And the best way to think about it is like Jell-O. You know, when it's warm and moving, it's all liquidy. But when it cools down and sits still, it gets firm, it gets stiff. If your knees are super stiff and painful for more than 30 minutes in the morning, but they loosen up as you start moving, that's a huge clue. So if you've got that morning stiffness thing happening, we have to play detective and look for other clues. For example, do you have knee pain and bowel symptoms like cramping or diarrhea? That could point to inflammatory bowel disease. Then we'd also look for other stuff like painful lumps on your shins, mouth ulcers, or even a painful red eye. Okay, here's another one. What about knee pain plus skin or nail changes? This could be screaming psoriatic arthritis. We'd look for those classic red, scaly patches of psoriasis, for sure. But we'd also check your fingernails for these tiny little pits. And I'm not kidding, the inflammation can get so bad that it makes an entire finger swell up like a sausage. So, here's a super important tip. If you have any rashes or weird skin things happening at the same time as your knee pain, take pictures of them. They might seem totally random to you, but to a doctor, those pictures could be the key that unlocks the entire mystery.
All right, now let's talk about stuff you can actually see and feel. I'm talking about lumps and bumps in or around your knee. These little deposits can be another direct signal from your body that something is way off balance system-wide.
So what's in these lumps? Well, they could be fatty plaques called xanthomas, which is a sign of seriously high cholesterol. Or they could be these clumps of sharp, nasty uric acid crystals, which means you're dealing with gout. Or the swelling could be from a bacterial invader, like the one that causes Lyme disease. Each one tells a totally different story.
And man, Lyme arthritis is a sneaky one. It all starts with a bite from an infected tick. You might see that classic bullseye rash, but a lot of people never do. Then, months go by, the infection is just simmering away, and suddenly, boom, about 60% of people develop arthritis, and very often, it shows up as one single, massively swollen knee.
Okay, we've gone through a ton of clues, but listen up, because this next part is, without a doubt, the most important. These are the red flags. These are the signs that mean you stop guessing and you get to an emergency room immediately. These are the signs you absolutely cannot ignore. Just listen to this quote. Time is cartilage. That's what orthopedic surgeons say when they talk about a septic or infected joint. A bacterial infection can literally eat away the cartilage and bone in your knee in a matter of hours, and that can lead to permanent disability. Every single minute counts.
Another major emergency is when a swollen knee isn't full of pus, but blood. This is called hamarthrosis. Now, if you didn't just have a major injury, bleeding inside your joint is a huge red flag. It could be from blood thinners, a clotting disorder, or even a sign of something totally unexpected, like scurvy or even cancer.
So let's make this crystal clear. You need to head to the ER if your knee pain and swelling come on suddenly and are severe. If the pain is so bad it literally wakes you up from a dead sleep. If you have a fever along with your knee pain, or if you absolutely cannot put any weight on that joint. This could save your knee, it could even save your life.
From being extra bendy to morning stiffness to those sudden scary red flags, your knees are constantly communicating with you. They really are a window into your metabolic health, your immune health, your overall health. So the only question left is, are you ready to listen?